Hi, my name is Kayla, and I'll be your nurse for this evening. I would like to talk to you about your new diagnosis of rheumatoid arthritis and explain what that is. Are you okay with that? Okay. So first, let's talk about what rheumatoid arthritis is and how it affects your attacks your immune system. So rheumatoid arthritis is a progressive inflammatory disease that attacks the joints and typically affects the upper joints first. In our joints, there is a membrane called the synovial membrane. This membrane lines the area around the joints and produces synovial fluid, which help keep the joints from rubbing against one another during movement. In rheumatoid arthritis, the body's white blood cells, which help fight off infection, actually attack the synovial fluid, causing inflammation and swelling. This can lead to joint damage due to the friction of the joint movement and lead to decreased range of motion. It can also affect other connective tissues in the body, such as blood vessels, membranes surrounding the lungs, and the membrane surrounding the heart. Early on, patients may experience fatigue and joint discomfort. However, late manifestations of the disease include the joint deformities and nodules, which are lumps over the joints. Some general signs and symptoms of rheumatoid arthritis may include pain while resting or with movement, morning stiffness, dry mouth, weight loss, fatigue, joint pain, numbness or tingling, also known as paresthesia, lack of function, low-grade fever, and muscle weakness. I would like to give you a referral for physical therapy. Someone with rheumatoid arthritis is typically referred to physical therapy or occupational therapy to help maximize functional activity of the joints and maintain mobility. I would also like to refer you to some support organizations. A diagnosis in rheumatoid arthritis can be life-changing, as you may not be able to do things that you once enjoyed, and it can also sometimes change your physical appearance with the deformities in the hands. So support groups are a good resource for you to connect with others in the community who may be experiencing a similar diagnosis and help you cope with the changes that you may be experiencing. So I would just like to give you some more information on those support groups available to you. And then you will also want to follow up with your provider on a regular basis just to ensure that your medication is still effective, to help prevent progression of the disease and to explore different avenues of treatment if desired. Do you have any questions?